Want me to open the scanning station?
Okay, go ahead.
Okay, so do you have a lot of writing for your job and like any examples?
Not anymore. We used to, but we've gone to an all-computer system at work. So we have all electronic charting. We used to have all paper charting. Now it's all electronic charting, so we have minimal writing.
What kinds, like what does that like accomplish of charting and like any sort of writing that you would write down?
We take a verbal report, so I may write down notes as far as things that are going on with my patient that I might want to remember, that I don't want to look up in the chart right away, just keynotes, important points that another therapist might tell me about the patient, something that I have to remember to put into the chart, I'll write down, things like that.
What is an average day for you at work?
An average day is basically ensuring patient safety, care, and making the patient better so they can go back to their family and their average life. Okay, so besides getting our patients back to their average lives, just like we are working, I come into work. Since I am the educator, I have students on a daily basis. So my job is a little different. I take care of being sure that my students learn how to be a therapist and to do the job correctly. But if I were on the floor taking care of patients, I would get my workload for the day. I would go to the floors, see my patients, give them their treatments, take care of my patients. If I were to be called to take care of a patient, make sure they're breathing properly, go to any emergency that happens. Trying to think of what else I would be doing.
So you would say that your job is really just for like helping people breathe, or like what would you say exactly is your job?
Yeah, our job is to ensure that they are breathing and that nothing goes wrong, and we are there to save lives on a daily basis.
How many years of schooling did you take to get your degree for the job?
It takes 2 years. It's an associate's degree, but it actually turns out to be 3 years. By the time you do your prerequisites and then you do the 2-year program.
Was this job actually your first choice when you started going to college? Or?
No, I was a cosmetologist first, and then I decided to do this.
What made you decide to switch over?
I had asthma, and it got to be so bad working in a salon that I was told that I could no longer work in a salon and I had to do something else, so I decided to be a respiratory therapist.
What kind of personality traits do you think someone in your field should have?
They have to be outgoing, a willingness to change direction at any given time. You have to be quick on your feet, and you have to be able to multitask all the time.
What are like any highlights that you've had with like working in your career?
For myself,
Yeah.
saving lives is a big highlight. Just that is a big thing, is to bring someone back to life and see them go home and be with their family. That's pretty exciting.
Are there like some aspects of your career that you don't think people normally think about when they hear the term respiratory therapist?
They just think we give treatments and give oxygen. They don't know that, we have people dying all the time, or that we work really hard, and, they just think we're,
They're just for like ease of breathing kind of.
Yeah.
What are some things that you like about your job and dislike about your job?
I love that it's not the same thing every day. There's always something different going on with our job. The things I don't like about our job is we do have people that die all the time. That's just what happens. It's every day.
What kind of skills do you think are necessary besides like being able to multitask and all that?
You have to be quick on your feet. You have to be able to deal with a change in the situation. You have to be able to think outside the box. You have to be creative. And you have to be able to change direction quickly in this field, because you may be taking care of one patient and then you turn around and they're bringing another patient in, and you have to be able to take care of both of them at the same time.
Are you satisfied like with your choice in career? Why or why not?
I'm very satisfied with my choice.
Is there any reason, or is it?
Oh, I love taking care of my patients. I love being in the medical field, and I wouldn't change it. I like what I do.
So your inspiration for choosing this career, was it just solely that you kind of saw people working in this career because of your asthma?
Yeah, somebody who was giving me a breathing treatment one time, and it was like, well, I guess I'll try that job. So the best thing for someone to do is to job shadow and see what other people do for a living, to see if they would like doing that job.
Do you think that you still have like the inspiration for your job now?
More so. Mm-hmm.
Like, would you care to explain, or?
Oh yeah, no, I like going to my job every day. I don't regret the job I've chosen. I see people that don't like their jobs every day on a day-to-day basis. I like going into work. I like being there for my 12 hours. I like doing my job, taking care of my patients. There's always something different. It's not the same job going and standing at a bank or going and sitting behind a desk every day. It's something different every day. It's a different patient. It's a different situation. So I like going to my job. It's not just sitting behind a desk every day.
Okay, and then last one. Is this job anything like you expected? Why not?
Yeah, the school prepared me for it, which is McComb Community College. Prepared me very well for this job. So, I was prepared for this job.
Did you think it was going to be like this when you first started, like, your schooling for it? Or the further you got in, the more you were like, okay, this is what it's about?
Yes. I mean, yeah, you think, okay, I'm going to save lives and everything. It depends on what hospital you work at, the type of situations you're going to get. You know, if you're working at a hospital that is in the inner city, you're going to see more shootings, you're going to see more drug abuse, you're going to see more of this. If you're working at a hospital that's, you know, in a more affluent area, you're not going to see as many drive-by shootings and things like that. So it just depends on your demographics. So the hospital I work at, we see all kinds of crazy things, and you know, you have to laugh at the stupid things people do, and you know, it keeps you on your toes, and it gives you something. Oh, what kind of silly thing is someone going to do today? You know, you look forward to what silliness is going to come through the emergency room doors, and how you're going to learn. I learn something new every single day, and I've been there for 20 years. And that's how I teach my students, because I have students, and I teach them every day something new, just like I learn something new every day. So I look forward to going into work and learning.
Cool. Thank you.
You're welcome.